Welcome to Community Health Focus, an educational partnership between Greenwich Hospital and Main Street Connect, your hometown online. Today we are visiting Drs. Christopher Musenik and Dr. Yihai Yu. Dr. Musenik is the director of the Weight Loss and Diabetes Center at Greenwich Hospital, and Dr. Yu is the medical director of that center. Americans are getting tremendously fat. Why is that, and what can we do about it?
Well, you're right. The population as we speak of now has about 30% of the population who meets the criteria for obesity, which we measure as a body mass index above 30. I think in 1980s, that prevalence is about 10 to 15%, and the trend is really going up. And if we don't stop that trend, by year 2050, the projected number will be half of the population, 50%. Similarly, diabetes also goes up. Presently, we have about 8 to 10% of population who have diabetes. But more importantly, there are undiagnosed diabetes, about twice as many.
Does this fit the criterion for an epidemic?
Absolutely, and people even sometimes call it twin epidemic. Obesity and diabetes goes hand in hand, and unfortunately.
What has happened to change our culture that make people eat too much?
Yeah, well, there are obviously genetics. Environment is the key because our genes has not changed really over the 50 years, 100 years. You don't have the gene change that much. We do have genes though that predispose us to storing more energy, to be fatter, and that's given. However, I think the environment is really such that it's not a friendly society in terms of food, exercise, so that unfortunately we get that epidemic.